The Menopausal Symptoms After Cancer Clinic is only one of two of its kind in Australia. It's a very unique service, and for our patient population, because in order to come to the clinic they've had a cancer diagnosis, there's already so many other appointments and infringements on their usual life that have an impact. For us to be able to provide something like this, where they don't need to travel long distances but can still get access to that very specialised service, is a wonderful thing and something I wanted to be a part of.
I heard about telehealth and I looked into it, and I realised that there were so many benefits for the women that we see at this hospital. So travel burden, the time being in the car, the cost of fuel, the cost of accommodation. The other benefit that I've seen is for women who aren't from rural or remote areas, they actually live, in or out of metropolitan, but might be single mothers with, young children. They might be currently undergoing treatment for cancer, so it's quite difficult for them to, one, fit it in with all their other appointments, or two, physically make it to the hospital. So for those women as well, even though they might not live 4 hours away, the ease of access, convenience, and also the physical burden on them has been of great benefit.
One of the reasons why Menopausal Symptoms After Cancer Clinic was an appropriate clinic to start with as a pilot is because for the vast majority of the patients we see, an actual examination isn't necessary. Given the consultation is a conversation, which includes taking a history from the woman around her background history as well as her actual menopausal symptoms, having a discussion about the impact on her quality of life and also what management options would be right for her. Therefore, that's a conversation that can happen as clearly via video conferencing as it can face-to-face.
So we have two online areas. The first one is the reception area where the patients dial in. They get met by the clerical staff who will check them in as they would a face-to-face appointment. So they check all their details, make sure they've got the correct person and everything's up to date. The clerical staff will then transfer that patient into an online waiting room. And then from the waiting room, it's very simple for the doctor to see when the patient is there waiting for them, and all they have to do is click on the patient and click join call, and they're having the consultation with the patient. From a patient perspective, I feel like the patients have found it quite easy to use as well. We send them a link that they follow. They pop the link in the computer. We do tell them to perform a test call prior to dialing in for their actual appointment. So we say to do a test call at least a couple of days prior so that if they are having technological issues, we can troubleshoot. And basically they just click on the start call button. They put in their name, their phone number, and it pops them into the waiting room, and there's little messages that will pop up and tell them that they are waiting for the specialist. They have contact details in there to contact the nurse coordinator if they've been waiting for a long time, if they're having issues, if they need to let us know anything at all.
The key value that we have had throughout this entire project is that the choice is with the woman. And there have been a number of women who live vast distances away, and I'm thinking of there's a woman who lives 5 or 6 hours away, and she much prefers to come into the hospital because that's her trip to Melbourne and she can do some shopping and visit her cousin.
Advice that I would give to women who might be hesitant about using telehealth is that it's actually a really easy service to use. The platform's quite easy. There's always someone here to support them if they need help with technology or troubleshooting.
So I think really talking to people, listening to them, addressing any fears or concerns from the very beginning so that everybody is on board is absolutely vital.